T'es médecin et tu veux travailler en Suisse. T'as juste un petit problème. Tu ne parles pas la langue. Si tu cherches à apprendre les bases d'une consultation médicale et comment faire une bonne anamnèse en français, cette vidéo est pour toi. Welcome back, guys. For those of you who are new here, my name is Sarah, and after graduating from King's in London, I moved to Switzerland, where I'm currently training as an internal medicine resident. I make videos about medicine, life as a doctor, and all things Switzerland. When I first moved here in Switzerland, after having studied in English my whole life, I definitely struggled. Despite already speaking French, I was completely new to medical French, which is a completely different ballgame. In the beginning, I just spent months listening to my colleague take clinical histories just to get my brain used to the sentence formulation through sheer osmosis. I read their daily medical notes and discharge letters and collated phrases that I could use in my own day-to-day practice. Now this worked, but it was definitely a steep learning curve. And to be honest, I couldn't really find many structured resources that could help me in this process. There were dictionaries and there were a few books, but nothing very hands-on and practical. And the thing you have to remember is, even if you have a B2 level of French proficiency, which is the minimum requirement to work as a doctor in Switzerland, that's just for general French. Navigating the medical world is completely different. And different people have different approaches, but generally speaking, I always think the best approach is to just jump right in. So like I mentioned in my other videos, getting an internship to get your foot in the door and then getting your first job. And then it's just sink or swim, and you'll just learn through sheer osmosis of being around colleagues who are speaking the language and having to communicate with your patients. And that C1 level, which seems very abstract, slowly it will build up to a C1 in medical French, and then you'll just keep improving from there. However, since a lot of you aren't in Switzerland yet and haven't got an internship immediately planned, welcome to Anamnèse Médicale 101, how to take a clinical history in French. Why, you may ask? Well, this is exactly what I would have wanted when I started off. Now, I've split this up into different sections of history taking, from how to greet your patient to how to take your leave. The idea is to give you a few examples in each section, and that way you've got a few options to play with, and you can also pick or choose the sections that are relevant to you depending on whether you want to take a detailed history or a very brief one. There's a key detail that I have to mention before we start. Now, in French, there's a formal way of speaking and an informal way of speaking, which you will use depending on the age of the person you're talking to, whether you know them or not, etc., etc. In English, we don't have that. We just speak pretty much the same to everyone. Now, this isn't a grammar course, this isn't a French course, this is how to take a clinical history in French. It's really the basics to get you started and to make that learning curve slightly less steep for you. So to give you the main example, you can either say est-ce que vous avez, for do you have, or you can say avez-vous. Avez-vous is the more formal way to say it versus est-ce que vous avez, which is more informal. Both are correct, you can pick the one that you like. Honestly, I use the informal one. All my colleagues pretty much use the informal one, so that's what I'd go with, but I just want to make you aware of the two options just so you don't get confused. So for the purpose of this video, I'm probably going to go with the informal one. Last thing before we get started, little disclaimer, this isn't the perfect way to take a clinical history. It's one way to take a clinical history. And once you get used to the French way of doing things, you'll develop your own style, your own technique. The key here is to be respectful to your patient, get the information that you need, and this is the way that I do it most of the time. I'm just providing you with a couple of ways to do it, and then you can pick the one that works for you. Let's get started. I want to make this video as useful as possible, so whenever I say something in French, the French subtitle will come up. That way you can practice. If you don't want to do that and just want the immediate translation, you can just click on subtitles on YouTube and you will have it instantaneously. Introductions. How will you present yourself to your patient? Pretty much like you do in English. So I would typically say, bonjour, je m'appelle Sarah, je suis un des médecins, enchanté. And then I would finish off with, comment ça va aujourd'hui? Or, que puis-je faire pour vous? Or, comment allez-vous? Or another one would be, racontez-moi. So these are sort of open-ended questions that will start off the clinical history. Some people would prefer to be a bit more formal and use their family name. So you can always say, bonjour, je m'appelle Dr. Smith, enchanté, comment ça va? But again, just pick the one that works for you. On that same note, we're going to talk about open questions. So this is something that we all know in medicine is really important. You want to prompt your patients with open-ended questions so they can give you a lot more information than your binary yes or no questions will give you. For example, your patient says, je me sens pas bien, I don't feel well. Instead of asking a specific question like, est-ce que vous avez mal? Do you have any pain? I often ask, c'est-à-dire, which means that is to say. So I'm sort of prompting them to be a bit more specific and explain what they're feeling. Another one would be to ask them to describe something. So if they say, j'ai mal, I'm in pain, you can say, décrivez-moi cette douleur. So instead of going straight into, is it a cramping pain, a burning sensation, just give them that space. So, décrivez-moi cette douleur. Describe this pain to me. And if they're struggling, you can always prompt them by saying, est-ce que c'est des douleurs crampiformes, des brûlures, une oppression? Is it a cramping pain, a burning pain, an oppressive pain? Another thing you can ask to keep it open-ended would be, parlez-moi de ces derniers jours. Tell me about the last few days. Or, parlez-moi de cette douleur. Tell me about this pain. So, parlez-moi de, or décrivez-moi. tell me about or describe to me. Just for those of you who want to stay very formal, another way you could say this would be pouvez-vous me décrire votre douleur? Pouvez-vous me parler de ces derniers jours? Pretty much the same thing, you pick. Okay, so now we'll go into a few more descriptive questions. A lot of you must know about SOCRATES. It's a mnemonic and a framework that can help you explore a symptom in more detail. So I'll put this up on the screen and we're just going to do the French version of it. So let's say in this scenario, your patient says, j'ai mal au ventre. I have tummy pain. So first you'll ask the open-ended question. So you'll say, c'est-à-dire, or décrivez-moi cette douleur. Once you've got the spontaneous reply from the patient and you want to dig a little deeper, then you can do your Socrates. So something I like to do to localize the pain is ask them to show me with their finger where the pain is exactly. Montrez-moi du doigt où se trouve la douleur. So that's a very helpful one. In terms of onset, you can say, quand est-ce que la douleur a commencé? Or, ça fait combien de temps que cette douleur a commencé? So when did it start? How long has it been? Est-ce que c'était soudain ou progressive? Was it sudden or progressive? In terms of the character of the pain, you can say, c'est quel type de douleur? Or, décrivez-moi cette douleur. So that's your open-ended question. So what type of pain is it? Or, describe this pain to me. And if you want to give them examples, like we said before, you can say, est-ce que c'est une brûlure, une oppression, des crampes, une décharge électrique? So is it a burning pain, an oppressive pain, cramping pain, or a stinging electrical pain? Radiation. Est-ce que ça irradie quelque part? So does it radiate somewhere? You can be more specific as well. Let's say it's chest pain. You can say, est-ce que ça remonte dans le cou? Est-ce que ça descend dans le bras? Or irradie dans le bras. It's all the same thing. Keep it simple. Est-ce que ça irradie quelque part? Does it radiate somewhere? Associated symptoms. So you can just say, est-ce que vous avez d'autres symptômes associés? Which is very vague. At this point, you definitely need to prompt to ask, est-ce que vous avez des nausées, vomissements? Do you have nausea, vomiting? Des diarrhées, constipation, brûlure urinaire, diarrhea, constipation, urinary dysuria. For our T, which is time in Socrates, how have the symptoms changed over time? Here, I stay pretty binary, so I say, est-ce que les douleurs sont constantes ou est-ce que ça fluctue dans le temps? So are they constant or do they fluctuate in time? You can also say, est-ce que c'est toujours la même douleur? And if there is a difference in the type of pain over time, you can say, est-ce que vous avez remarqué s'il y a quelque chose qui aggrave la douleur ou qui diminue la douleur? Have you noticed if anything worsens the pain or reduces the pain? If you want to be more specific, for example, for chest pain, you can say, est-ce que la douleur est pire à l'effort? Is the pain worse on effort? And then for severity of pain, on a scale of 1 to 10, I mean, it's the same way you would say it in English. I typically say, c'est très subjectif, mais entre 0 et 10, 10 étant la pire douleur et 0 étant pas de douleur, vous êtes environ à combien? And it's just to make them understand, it's not a definitive answer, but roughly, where would you be on this subjective scale? Now, for the other sections of your clinical history, you want to know about the past medical history. So it can be as simple as saying, est-ce que vous avez des comorbidités? Do you have comorbidities? But for many patients, the term is pretty abstract and they might reply no, but actually you find out they've got 10 different comorbidities later on. They just didn't understand it was a comorbidity. So there's different ways to go about this. One would be, est-ce que vous prenez des médicaments? Do you take any medication? Because that will definitely help you to shed light on the comorbidities. Another way that I often ask the question is, est-ce que vous avez des comorbidités? Par exemple, la tension, le diabète, le cholestérol. So I say, do you have comorbidities? For example, high blood pressure, cholesterol, diabetes. And that's usually enough to get them started on their list of comorbidities. Another way would be, est-ce que vous êtes suivi par votre médecin régulièrement pour des maladies? Are you seen regularly by your family doctor for certain illnesses? And that's another good way of getting the list because they'll be able to tell you what they go in for and how regularly. So that's really helpful because the frequency of the follow-up will give you an idea of the severity of their comorbidities in some cases. For allergies and medication, pretty easy. You can say, est-ce que vous avez des allergies? Do you have allergies? You can also say, vous avez des allergies? Exactly the same thing, just fewer words, which is also fine. And for medication, you ask, est-ce que vous prenez des médicaments? Or, vous prenez des médicaments? Do you take medication? Side note on medications, if you're not in Switzerland yet and you're planning on coming here, they mostly use brand names here, not generic names. So for example, furosemide is not furosemide, it's not furosemide, it's Lasix. So everybody here says Lasix and they'll just assume that you know what Lasix means, which is a shame because medicine would be a lot easier if we all used the generic names rather than brand names. But that's just to say when I started off here, patients would give me lists of medications and I would just be lost. I didn't know what they were and I'd have to look up each brand name to find the generic name. If this is something you're interested in and you'd like a video on the most common medications with their generic names and brand names, let me know in the comments down below. So for family history, you can always say, est-ce qu'il y a des maladies dans la famille? Are there any illnesses in the family? Oftentimes, if I ask this question, it's going to be related to, let's say, somebody who's presenting with chest pain, and I'll ask, Est-ce qu'il y a des maladies cardiovasculaires dans la famille? Are there any cardiovascular diseases in the family? So you can either keep it vague or you can ask for specific conditions. Another example would be, est-ce qu'il y a du diabète dans la famille? Is there any diabetes in the family? Then there's a section called habitude, which is habits, and essentially that includes smoking, alcohol, and then other drugs. And the way that you can ask this is, est-ce que vous fumez? If you're struggling with this video and you find that the sentences are too long and they're too complicated, pick the shortest version, make it easy for yourself. So for all the phrases where I say, est-ce que vous, etc., let's say, est-ce que vous fumez? You can just shorten it to vous and the word. So, vous fumez? Vous avez mal? Do you smoke? Are you in pain? So vous and the verb is totally acceptable. And if that's what it takes for you to get started, then so be it. Now we get to a bit of a broad section, which is systemic history, where you can do a quick systems review and ask about other symptoms. So we're not going to do all of them, but just a few ones. So let's say for neuro, you can say, est-ce que vous avez des troubles visuels? Do you have any visual disturbances? Des céphalées, headaches. Une perte de force, weakness. Une perte de la sensibilité, loss of sensation. For the respiratory system, a few things you can ask. Est-ce que vous êtes souvent essoufflé? Are you often out of breath? Et à l'effort, and on effort. Est-ce que vous toussez? Do you cough? Est-ce qu'il y a des crachats? Is it productive? For the cardio system, you can ask, avez-vous des douleurs à la poitrine? Or, est-ce que vous avez des douleurs à la poitrine? Or, vous avez des douleurs à la poitrine? Or the same for, do you have chest pain? Des palpitations, palpitations. Des douleurs dans les jambes quand vous marchez, pain in your legs when you're walking. Les jambes gonflées, swollen legs. Or, des œdèmes dans les jambes, edema in the legs. De la peine à respirer quand vous êtes couché, struggling to breathe when you're lying down. For the GI system, you can ask, est-ce que vous avez des douleurs au ventre? Do you have tummy pain? Constipation ou diarrhée, constipation, diarrhea, des remontées d'acide, acid reflux, du sang dans les selles, blood in your stools. For the GU system, you can ask, est-ce que ça brûle quand vous urinez? Does it burn when you urinate? Est-ce que vous urinez plus fréquemment que d'habitude? Do you pass urine more frequently than usual? Est-ce que ça vous réveille la nuit? Does it wake you up at night? Est-ce qu'il y a du sang dans les urines? Is there blood in your urine? For women, vous connaissez la date pour vos dernières règles? Do you know the date for your last menstrual period? And then for general systems / B symptoms, you can say, est-ce que vous avez perdu du poids récemment? Have you lost weight recently? Est-ce que vous avez de l'appétit? Do you have an appetite? Est-ce que vous transpirez beaucoup la nuit? Do you sweat a lot at night? Est-ce que vous faites de la fièvre? Do you have fever? Est-ce que vous frissonnez? Do you shiver? So this is broadly speaking your systemic history. Obviously we can go more detail, but this can get you started. Now we can talk about the miscellaneous section. So this has some really important phrases that I think we should all think about and mention when we're taking a history, as well as some phrases that you definitely need to know just to get through your consultation. So one of the most important ones is to really know what matters the most to your patient. They might have mentioned 10 different symptoms to you, but actually the one that matters the most to them is the last one. And since you've taken a whole history and maybe to you the first one is more serious, you might focus on that one and just have a tunnel vision. So I think it's always really important to ask your patient what matters to them the most. So there's different ways you can ask this in French. You can say, qu'est-ce qui vous dérange le plus? What bothers you the most? Or you can say, qu'est-ce qui est le plus important pour vous? What's the most important thing for you? This question is key because if you don't know what matters the most to your patient, if you don't know what their priorities are, there's no way that you can provide good medical care. Good medical care is not the most invasive medical care. Good medical care is safe medical care, it's appropriate medical care, and it's meeting your patient's needs and priorities as well. So, qu'est-ce qui compte pour vous? What matters to you is a really important phrase to know. Another one you might want to ask in the consultation would be, comment vous vous sentez maintenant? How do you feel now? Because maybe they've had chest pain for a week, but actually right now they don't have any chest pain. So it's a pretty useful one to know. You might want to ask, est-ce qu'il y a autre chose que vous voudriez rajouter? Or est-ce qu'il y a autre chose que vous voudriez mentionner? Is there anything else you'd like to add? Is there anything else you'd like to mention? You might want to ask, est-ce que vous voudriez des antidouleurs? Would you like some painkillers? Another key one is, est-ce que vous avez des questions? Do you have any questions? The formal one is, avez-vous des questions? Do you have any questions? Another good one to know is, n'hésitez pas si vous avez des questions. Or, n'hésitez pas si il vous faut quelque chose. Don't hesitate if you have any questions, or don't hesitate if you need something. It's just a quick, encouraging phrase you can add just to show that you're available if they need you. And then if you're giving them a sick leave or prescription, you want to know how to say that. So you say, voici votre ordonnance. Or voilà votre ordonnance, so here's your prescription. And you can say, voici votre arrêt de travail, or voilà votre arrêt de travail, here's your sick leave. You might find it helpful to know how to say a few of the investigations in French. So let's say you finished your clinical history and you're just explaining to your patients what the next steps are going to be. So for example, you can say, on va faire une prise de sang, we're going to do a blood test, un frottis nasopharyngé pour les virus, a nasal swab for viruses, un électrocardiogramme, an ECG, une radiographie des poumons, a chest x-ray, et un test des urines, urine test. And you can finish off by saying, je reviendrai vers vous quand j'aurai les résultats. I'll get back to you when I have the results. Or you can say, je vous tiendrai au courant des résultats. I'll keep you updated with the results. And now, if you've finished your clinical history, you've explained the investigations, and you basically want to say bye to your patient, you can just say au revoir, à tout à l'heure, which is bye, or see you later. And if it's their last day and they're leaving and you won't see them again, you can say bon rétablissement, which is essentially get well soon. Or you can say bonne continuation, which literally means good continuation. Or an informal way to say it is tout bon pour la suite, which means all the best for the future. So there we have it. This is the 101 basics of a medical history in French. I hope you found this useful. If you have any ideas to improve the structure of these videos, or if you would like more French medical videos, let me know in the comments down below. Have a wonderful day, and I will see you in the next video. Bye!